You're watching Living Well on WMBD.
There is nothing worse than living every day of your life in pain. Every time you stand, sit, or move, you are painfully aware of the change, and it's hard to contemplate. For people who in need of knee replacements, it's a way of life. With help from a guest that we have here, Dr. Richard Driessnack. He's an orthopedic surgeon. It doesn't have to be that hard. He's here to offer help and hope. Well, welcome to Living Well.
Thank you.
Tell us a little bit about your background.
Well, I'm a Midwesterner, born and raised in Michigan, educated in Michigan, and after finishing my training, worked for a couple of years in Wisconsin, and then did a year's advanced training in Denver, Colorado, and then from there came to Peoria. I've been practicing here for 20 years, give or take, and a little stint in Nashville, Tennessee at Vanderbilt University, and then back to Peoria.
Wow. Well, your specialties are hip and knee replacement specifically, correct?
Yes.
Tell us about the custom knee replacement.
The custom knee replacement is one that I've used for several years now, a couple of years. It's a concept that really attracted me to look at it further about 2013. The concept is that the prosthetic implants are made specifically to fit each individual patient. Mm-hmm. The implants are fabricated from a CT scan generated three-dimensional model of the knee joint. So the fit should be better than anything that you can get out of the box off the shelf.
Now, how does this particularly work?
Well, this knee is put in exactly the same as any other knee replacement. There tends to be a little less bone removal from it, so it's more bone conserving. The fit, as far as the size and the shape and the radius of curvature, matches each patient's knee better than an off-the-shelf knee. So hopefully the plan, the intention is that it will feel better to the patient's tissues. It will cause less pain. It will have a better long-term fit. It will feel more like a natural knee. And that so far has been my experience in using this for 230 plus cases.
And that's so key because people avoid this because of fear, right?
They really do, yes.
And we don't want that to happen because you can make your situation worse if you prolong the surgery, correct?
Yes, by delaying or procrastinating, as I call it, because of fear, you not only lose out on quality of life years where you could be living life more comfortably, but you could be causing more damage to bones, more deformity, and it could make the operation more difficult in the future. So their ultimate result may not be as good.
And then last but not least, some people are afraid how long they last. How long do they last?
Well, we used to say 7 to 10 years. That was back in the 1970s and the 1980s when I first started developing an interest in this. But now contemporary implants should last 20, 25, even 30 years.
Oh, that's absolutely wonderful. That 10-year thing is scary. Well,
yeah.
I appreciate your stopping by and sharing this very helpful information. Now, if you would like to learn more, he has 2 locations in Peoria, and both of them are listed on your screen. You can call 309-676-5546. You can also visit his website, which is PeoriaJointReplacement.com. Thanks again. Stay with us. We'll be right back.